and delighted to be wearing a mask provided by the Arkansas Nurses Association, and Dr. Smith has it on as well. I'm very proud to be wearing these today and appreciate all the nurses in what they've done. I also just want to draw attention to a historic day, and I've issued a proclamation for Juneteenth, which is so important for us to remember the mistakes of the past, but also celebrating freedom, African American freedom, while encouraging respect for all cultures. Juneteenth is being celebrated in Arkansas, and we're delighted to have this proclamation. Today, of course, we're joined by Dr. Nate Smith. Good to see him today, Secretary of Health. We also have A.J. Gary, our Director of ADAM, that's here. And then we're joined by Representative Carlton Wing, who has been very instrumental in the announcement I'm going to be making shortly, and Ken Kelly, who is the Secretary of the EMT Association in Arkansas, who has been an advocate for the announcement that I will make. Before I do that, I wanted to mention one thing, and that is that the unemployment rate has declined in the month of May in Arkansas, and we have the national unemployment rate, and then we wait for the state numbers to come out. They just came out today, and the May unemployment rate declined in Arkansas by 1.3%, which brings us down into single digits. We're at 9.5%. This means that there's 46,000 more Arkansans employed, exactly 46,378 more Arkansans employed in the month of May, and this is almost 4 points lower than the national unemployment rate at 13.3%. So this is good news for those that depend upon work for their families, their livelihood, and we hope that we can continue to bring more Arkansans back to work. Now, if we go to the first slide, I wanted to express my thanks, and I see Senator Missy Irvin that's here, who both Carlton Wing, Representative Wing, and Senator Irvin has been very supportive of having payments for emergency medical service workers. And as you all know, we've provided some direct payments for our frontline care workers in hospitals through our hospital institutions, and but there was a case made that we ought to provide some direct service funds for the emergency medical service workers. And so this CARES Act Steering Committee approved $12 million for EMS direct care worker payments. $10 million was approved directly to the workers, and $2 million was approved for the payroll taxes part of that side of it. And these funds will be distributed to the employer, important to remember, who in turn distributes the payments to each employee according to the number of hours that they worked. And this will impact 5,053 workers in Arkansas who are licensed as emergency medical technicians or paramedics, and they will be eligible for these payments. And they will be for the time period beginning April 5 through May 30th. And if you go to the next slide, you can see how it will impact each one of those. It's for those who work at least part-time, 20 to 39 hours, $125 amount per week. And then if they work 40 hours or more, they'll be getting an additional amount in their paycheck as well. And so these will be a real recognition of the risks that they have taken and the service that they have provided. Because as you remember, particularly in the early days of the pandemic, when they were called out to pick up someone or emergency medical situation, they didn't know what was going to be behind the door or with that patient. So they were putting themselves at risk, and we're grateful for their service. And Ken, if you would come and make a comment. And again, let me thank the General Assembly today approved this money. And we thank you for that through the ALC, Senator Irvin, and Representative Wing. Ken?
Certainly. Thank you, Governor Hutchinson, and those present here today, Secretary Smith and Representative Wing and Senator Irving. We appreciate very much this opportunity to be here to represent your emergency medical services system. Today, I'm here primarily representing two groups, the Arkansas Ambulance Association, which represents the ambulance service providers, but more importantly, the Arkansas EMT Association, which is the direct representative body for the boots on the ground, the EMTs and the paramedics that serve our communities every day. As the governor went over some of the numbers, you heard 5,000 some odd professionals that respond in our communities. Our communities very much depend on emergency medical services, not only for the time-sensitive emergencies such as heart attack, stroke, trauma, and other things, but also a continuum of care bridging the pre-hospital emergencies and medical care to our hospitals and our long-term care facilities. So we are very pleased that the state has taken this action and thank all of those that have been out there on the front lines. We cannot do what we do every day as ambulance providers without our EMTs and paramedics, and we're very proud of what they do. And with that, I just want to say thank you, and this is a great day for EMS in Arkansas, and we are ready today, and we are prepared for tomorrow.
Thank you, Director. And I would remind everybody who's listening who will be the beneficiary of these payments that it has to be processed through DHS to the different employers, and then the employers will process it out. And I've learned when it came to our hospital workers that takes some time through that process. And so you can count on it, be patient, and we'll be getting that money out. And then that brings me to the cases for today. Yesterday we had 13,928 cases in Arkansas. Today we have an additional 703 cases statewide. Of these, 41 are in corrections, which means that this is the largest growth of community cases that we have seen in a single day. That brings the total to 14,631 cases in Arkansas. And I know Dr. Smith, when he comes, will elaborate as to where we see the transmission and where these cases are coming from, which if you look at the counties, it's really the same sources that we've seen in previous days. Washington County, 136 cases. Benton County, 112. Pulaski County, 53. Sevier County, 44. Sebastian County, 26. Faulkner County, 22. And Yell County, 21. The rest of them are less than 20 cases. And so you can see where the concentration of new cases are. And we are continuing to deal with that. We don't, whenever we see new cases, we implement the strategy for contact tracing, for contacting these individuals, for isolation to prevent that spread. It is a lot of work. It's a lot of running these cases down, and I'm delighted that Dr. Smith will be able to talk about the CDC and their work in Northwest Arkansas as well. In terms of hospitalizations, we've had an increase of 5, which brings our hospitalizations to 231, and we have 6 additional deaths, brings that to 214. We conducted over the last 24 hours 5,167 tests across the state, and the important statistic is the overall positivity rate. The overall positivity rate that we've seen is 6.5%. Since we started the pandemic, we continue to monitor that. And if we go through the graphs, you can see that, again, this is the largest day of the orange, which are the community cases in a single day, even though this is not the largest day of total cases in a single day. And then if you go to the rolling graph, you can see the up and down, and obviously whenever you have a 7-day rolling average with this spike that we see today, that means that over the next 7 days you're going to see that trend line go up some, and it's going to take us a while to get that back down. You go to the next slide, you'll see this is the rolling average, as I mentioned, of positive cases in Arkansas which is, again, a new graph that we're starting to show from time to time. 10% is, of course, the CDC guidelines. We've largely stayed underneath that. Our 7-day rolling average stays underneath that. And the latest positivity rate is about 7%, even though we're really targeting our testing to a large extent through our public health department. And then if you go to our next slide, we'll see that we're on target for the month of June, where we set a goal of doing 120,000 tests. We're at 92,275 tests, and it will be continue over the weekend and through the rest of the month. And then finally, I wanted to talk about face coverings. And Dr. Smith, at my request, is issuing, and with the support of the public health team, the Department of Health is issuing new guidance today in reference to face coverings. And based upon the above data that is cited, and we wanted to really lay this out for the public as to the reasons that face coverings make a difference. And so that's articulated in the guidance, and they make the following recommendations, and these are the highlights of it: that face covering should be worn in all indoor settings where you're exposed to non-household members and physical distancing of 6 feet or more cannot be assured. Very, very important. And then in outdoor settings where you're exposed to non-household members, you should wear face coverings unless there is a space of 6 feet or more that you can practice physical distancing. And then it goes on and describes that cloth face coverings have been shown to be sufficient for the general public and effective in preventing transmission. And it describes very clearly as to how the covering should be worn to protect against that transmission. This is important guidance for the public. Now, just so there won't be any confusion, this is the same type of guidance that we give to our houses of worship, which is the best practices that they should implement, but it's not a directive in which carries a civil penalty with that. And that is an enforcement issue, but it's also, when it comes to churches, recognizes that separation of church and state. But we provide that guidance, and by and large, churches have adhered to that. We're asking the public in the same way to follow the recommendations of the Arkansas Department of Health, and this will be posted on the website today. And this is an important additional announcement that we're making today to help guide that. And I encourage everyone to really look at some of the case studies that are in the guidance and references the scientific literature that shows that when face masks are used by 50% or more by a majority of the population in public settings, then it is effective in starting to reduce that transmission. And so help us out, follow that recommendation, and it'll make a difference as we go through this. With this, Dr. Smith.
You are watching Governor Asa Hutchinson's coronavirus daily press briefing. Had a moment there of technical difficulty with the feed coming from the governor's office on YouTube. I'm going to just update you now as we wait to get that back up. But we have 703 new coronavirus cases in the state of Arkansas in 1 day's time. 41 are in correctional facilities. The remainder are community spread, as the governor said. This is the largest growth of community cases we have seen in a single day. 5 more hospitalizations. 231 people are in the hospital right now, and there have been 6 additional deaths. 214 Arkansans have died from coronavirus. You can see our rolling average there since this began on March 11th. Today, again, the highest largest growth of community cases that we've seen in a single day. Of those new cases, 136 of them in Washington County, 112 in Benton County, 53 right here in Pulaski County. 5,167 tests have been run in one day's time, with a 6.5% overall positivity rate so far in Arkansas. The governor also saying that the unemployment rate is down 1.3% in Arkansas. It currently stands at 9.5%. The governor also issued guidance today, along with the Department of Health, on face coverings, how and why you should wear them. It's not a directive, but it is guidance. And we're going to take a check now to see if that feed is back up. Let's take a look. Okay, not yet, I'm told. Again, as we mentioned, it is the highest number of cases, and I think I'm told we're seeing the governor or the health secretary now. It was a mistake. I apologize for this. I'm going to sit with you for a moment just to see if we can get this feed back up and running. But as I mentioned, Washington, Benton, and Pulaski counties with high numbers of coronavirus cases. Also in Sevier County, seeing 44 additional cases. Sebastian County, 26, and Faulkner County, 22 cases so far. We are so far on target for the testing here in the month of June. The goal is to test 120,000 Arkansans. So far, we've tested 92,275 people. And again, if you're just joining us as we await the governor's YouTube feed to come back up, we're having some technical difficulties. Just do want to address that there are 703 additional coronavirus cases. Cumulatively, since March 11th, we've seen 14,631 cases. So we are still working on getting the feed back up and running for you to watch here on THV 11. Let's see. I know there was some. I think we have it now.
The pattern like that, and you go back the 5 or 6 days of the average incubation period, at least there's a suggestion that what's happening on the weekends is having some bearing there. So we have focused a lot of attention on work sites, which is good and appropriate. We need to continue to do that, but when it comes to the weekend, people can't let their guard down in terms of attending large events, not physical distancing, and especially not wearing masks, because then we can see transmission in those settings. And one of the settings that I want to particularly point out are places of worship. Those are very affirming, important parts of the community's activity, and they can be done just as safely as we can in work sites, but we need the same precautions. We have a list of about 25 places of worship so far where we've had one or more cases, not necessarily transmitted in that place of worship, but people who were in attendance who had COVID-19 infections. Unfortunately, in at least a third of those settings, the place of worship was not implementing masks, at least not requiring it, or not. The majority of attendees were not wearing masks, and that's a risk, especially in larger congregations. So this is something that we need to look at very carefully if we want to limit the spread of COVID-19, especially on the weekends. We're also continuing to look at hospitalizations very carefully, making sure that no hospitals have an excessive number of cases. The largest number that we have in any one hospital is 33, 18 ICU and 9 ventilator. So we're continuing to monitor that situation carefully. And the last thing I wanted to talk about was our CDC team. They continue to work in the northwest part of the state, Benton and Washington counties. Among the activities that they're doing, specifically they're mapping those transmission networks so we can get a better idea of how to interrupt those chains of transmission. They're able to do a deeper level of analysis than we're able to do in real time as we're doing our contact tracing, and we expect that to be very valuable to us. They've indicated at this point they plan plan to be there for about another 2 weeks. With that, I'll go ahead and turn it back over to the governor.
Thank you, Dr. Smith. I did want to recognize Dr. Jose Romero, who will be coming in for Dr. Smith in the coming months. With that, we'll be happy to take any questions.
I have a question for Dr. Smith. There was a report on National Public Radio today. It wasn't their own research, but they cited research saying that Arkansas needs 1,600 contact tracers based on our population. Is there any way to actually reach that number here?
There have been a number of different ways of calculating how many contact tracers that we would potentially need. An earlier report had said over 900. It really comes down to the strategy that you're using for contact tracing. Some states, they're using fairly low-level trained individuals, more like community health workers, and they will need a lot. We are finding it more useful to have people with a higher level of training, and also using software. Our Sarah Alert software can help us in that as well. Also partnering, for example, with educational institutions and with work sites to enable us to help us with that contact tracing. I don't think we'll need that many, but we'll continue to grow our numbers to meet our needs.
What would be optimal, do you think, if you could have what you want?
Well, you know, part of this is not trying to see where the puck is now, but where the puck is going, and anticipating how many active cases that we're going to be dealing with a few months from now. It's difficult to know. We've had our ups and our downs with that. Certainly the 350 that we will be adding as part of the CARES Act Steering Committee will more than double our contact tracers, and that will help. And in particular, it will give us people who are specifically trained to do that work and equipped.
Jake?
I guess at this point, why not just put out some directive for mask wearing? Maybe not just a blanket, you have to wear one all the time, but why not implement some of that more so into the community, especially if, as Dr. Nate said, you know, we're seeing this as being a problem of being out and about on the weekends.
Well, my experience with Arkansans is you give them information, they will make good judgments. We're trying to give them good information so that they make good decisions in terms of public health. It's also an enforcement issue. And, you know, today I had an email from someone who traveled through Arkansas and went to a particular restaurant and said only 2 of the waitstaff were wearing masks, and asked us to enforce our directive, which is appropriate. Filed a complaint, and so you know, we'll have someone from the Department of Health go out and look at enforcing that. So I think it's most important to use enforcement resources for where our directive is in place in terms of restaurants and other businesses, because those are directives. But this is not what you want to see in Arkansas, that you're going to be having people call the governor's office and say, I saw John or Jane Doe out on the street, they didn't have a mask. You know, and so if you're going to make a law or a directive, and that's what a directive is, then it makes it's not good policy not to have the ability to enforce, or the fact that you know, it's going to really make the directive illegitimate to begin with. So that's the reason that when it comes to individuals, it is guidance that we expect and want people to follow. And that's the reason that because we had the guidance in many different places and we pulled it into one and made it more clear. Hopefully it'll have a greater impact with Arkansas. Yes?
Is there any other location where you would consider making it a directive, like a grocery store or a big box store?
That's a good question, and we've already done that in terms of some of the face-to-face businesses. There are directives as to how they reopened, and this was put into place in terms of face coverings being a part of it. we do have that in place in terms of workers in some of the essential industries, but from a public standpoint, we have maintained with this guidance. We've continued to evaluate what works well, and if we need to make adjustments down the road, we can make adjustments.
I guess, again, sort of in response to Fayetteville and now Little Rock putting out their mask orders and things like that, how would that differ maybe from cities putting curfews in? It's something that they feel that our city should do this. I'm just kind of curious as to what the difference between the two might be.
Well, we gave, under our original emergency powers, we gave authority for cities to coordinate with us in terms of curfews. We still have that same policy. If they coordinate with us, we'll see if it is in conflict with our general guidance. But it's important that the public have one general guidance on this issue, and it should come from the Department of Health. We have provided that guidance, and if there is something that's consistent with that, that's not more restrictive or goes against it, then we'll have that conversation with particular city. I have not seen that push. I've talked to a lot of mayors. I was in Fort Smith yesterday. They support this guidance that we're giving from the Department of Health. Is there a question that is remotely?
Governor, what is your position on the removal of the Confederate statue from MacArthur Park? And do you have any thoughts on the two Confederate statues on Capitol grounds in light of that?
The question is in reference to the Confederate statues that are on the Capitol grounds as well as in MacArthur Park that was removed by the City of Little Rock. In terms of the City of Little Rock, is a city decision. The mayor made that decision. Our Department of Parks, Heritage, and Tourism actually had an easement on part of that, and we're having to work through that issue with the city, but we'll also be working with the city to see where an appropriate place for that statute to be. Secretary Hurst has a lead in that. And she is coordinating that effort. In terms of the state capitol, that's a matter of General Assembly. We'll have to address that, and so it's not something that can be really considered until down the road, and that's the will of the General Assembly. Yes?
What do you think should be done with the statue that was in MacArthur Park?
What should be done with it?
What do you think should be done with it?
Well, it should be put in an appropriate place where it can, be respected, and one of that's been suggested is the Confederate area of the National Cemetery, and so that's one of the things that's being considered. But that's something that we want to coordinate between our Department of Parks, Heritage, and Tourism and the city.
With the emphasis on masks and kind of what you're saying today, do you still have, are you still seeing the same thing in terms of this not being transmitted in restaurants and other locations like that have been able to open up? And if not, then where in the community is it being transmitted?
And we look at that very closely, and so, Dr. Smith mentioned churches today. But in terms of restaurants and others, we don't see a correlation between the increase in cases and the lifting of restriction in those areas. But Dr. Smith, if you would come and comment on that more specifically.
Certainly. I think where we're seeing transmission is in any places where people are gathering and they're not maintaining physical distancing or wearing masks. And I think from community to community, that can differ. Part of what we're hoping that our CDC team will do is, as they map out those transmission networks, we will get insight into, in those communities that are being hardest hit with COVID-19 right now, where is that happening? Now, for those of us living in communities, we probably have that knowledge without having to have a CDC team come and map it, and we shouldn't wait until we have COVID-19 increasing in our communities, we should use the knowledge that we have. Don't gather in large groups where there's no physical distancing and no wearing of masks, because those are the areas, that's the setting in which COVID-19 spreads very, very rapidly.
With the protests at the Capitol and also?
I think any gathering that meets those criteria, you get close, you're breathing each other's air, no masks, that's a potential. The virus doesn't matter what the purpose of the meeting is. On the other hand, if people gather and they maintain physical distancing and they're wearing masks, we've seen in many settings that the spread of COVID-19 in those settings is limited or non-existent.
Is there another question remotely?
Governor, this is
All right, the First Lady.
Governor Hutchinson. Go ahead. This is Allison with 4029 News. You touched on this yesterday, but is there anything enforcement-wise that your administration would consider ahead of President Trump's rally in Tulsa to ensure that any Arkansans who are traveling there do quarantine when they return, or any Oklahomans who may be traveling to our area afterwards, follow those guidelines?
Well, let's wait and see. This is a real test as to how the rally is conducted. From what I've seen, they're trying to follow CDC guidelines, screening, and I hope the mask wearing and the social distancing is a part of that rally. And to me, that's a very important part in terms of the public health. What I've said is that if an Arkansan, I'm sure there'll be many Arkansans that will go over for that rally, that if there is not appropriate social distancing, wear a mask. And if you don't do that, then I hope that you will have a test when you come back, because we don't want that to contribute to the other challenges that we face in the state. And then there's one other lady on the remote.
Yes, this is Clarissa with KNWA in Fayetteville. As you probably know, Kansas has put Arkansas on its quarantine list. What are your thoughts on this, and do you think other states will follow suit?
I actually thought it was a little odd. I looked today over lunch at comparing our cases with Kansas, and there's really not a great deal of difference in the number of cases that each state has. But regardless, that's the decision that the governor made, and I don't see it having a great impact on Arkansas. Obviously, people from New York and all over the country can travel here. They're coming to our great state parks, and I guess we'll miss a few Kansans that might not be able to come here because of that. Jake.
I've seen some social media sort of firing up, obviously today being Juneteenth. Would this be a day that you would be in favor of making this a state holiday?
Well, it is a very, very important day in our history. It needs to be celebrated. It needs to be remembered. As to whether it's a national or state holiday, that's an issue that I'm not ready to embrace yet, just simply because a state holiday is, another, if you're going to substitute it for a different holiday, but there's a limited number of holidays that we can have. And of course, we have Dr. Martin Luther King, which is an important holiday. And so the question is more of are we going to have a new holiday or substitute it for an existing holiday? And I don't think we're ready to embrace that yet. Yes.
There's a survey taken by Harvard University around the country that indicates support for vote by mail in Arkansas. And we now have models that suggest a huge rate of infection at the end of September. That Dr. Patterson's been addressing because it predicts such a high number of people in the hospital. So given that information and the fact that it takes a while to prepare, are you at all amenable to changing your stance on no excuse mail-in ballots in the general election?
Well, let me be clear on the distinctions in terminology. You have, of course, your vote by mail, which has not been embraced in Arkansas through a legislative standpoint. But in terms of no excuse absentee voting, that is something that we utilized in the special elections, and certainly is something that we ought to consider for November. If we still have the pandemic then, that's a health precaution. It allows voting in different ways, but it also has security measures in place that the legislature has established for identity of a person who will vote absentee. And so voting absentee is different than simply a vote by mail protocols. And I'm waiting to hear from our county clerks as to whether they're requesting action on my part and the State Board of Election Commissioners as to what relief they need as we prepare and look at a November election. They gave me counsel. They gave suggestions as to how we should do the special elections. So I'm anxious to hear from them as to what measures they think need to be taken. Jake?
Yesterday, Dr. Cam Patterson testifying over there at Big Mac said their modeling had potential for end of September into October at 50 times what we're currently sitting at in terms of hospitalizations, cases, all of that. Kind of what's your reaction to hearing that potential?
Well, of course, I've looked at that. I get that report every week, and the modeling, is a mathematical equation based upon certain criteria. We want to change the facts that go into that, which is the contact tracing, the isolation, the work that we're doing day in and day out. And so with that, I expect to beat that modeling projection, but you also prepare for a worst case scenario in the event that would happen. And one thing we know is that this virus is unpredictable, and I'm not going to try to predict what it's going to be like in October, but prepare for any circumstance. And I do want to invite Dr. Smith, if you have a comment on that modeling.
I really do appreciate the predictive models that have been out there, both the ones that have been generated within our state and the ones that others have done outside of our state. This pandemic, though, has proven to be very, very challenging to model mathematically, and there's been a lot of twists and turns. We've had here in Arkansas really more ups and downs, driven more by local clusters and regional upticks rather than the type of uniform growth that a mathematical model would predict. So we'll keep looking at those models, but I think with COVID-19 especially, we need to look at our data and see what's happening and what we're doing about it, and that's probably will guide us more accurately than trying to project out weeks or months ahead.
Is there one more question remotely?
Yes, Governor, good afternoon. It's Neil Gladner in Hot Springs. Thank you. I want to go back to the answer about the rally and put that in the context of any other congregate setting, so not just the rally. And if I heard you right, you said you hoped if Arkansans went there and found people not social distancing that they would wear masks. But if I go back to what Dr. Smith said, that I wear a mask for you, you wear a mask for me, I'm not sure I'm clear about how wearing a mask in a congregate setting without social distancing helps protect Arkansans.
Well, it does. If everybody's wearing a mask, then you're going to avoid the spread of COVID. And so that's one of the things in our recommendations, our guidelines that we presented today, that if you can go outside and you can stay physically 6 feet apart from someone, then there's not a requirement that you wear a mask. But if you have to get within that 6 feet, then you need to wear a mask. And if there's any doubt, wear a mask. face covering. But to me, there's, if you have a larger gathering, you ideally would do both, but at a minimum, you would do the face coverings if you cannot physically distance. And Dr. Smith, you haven't commented on that. Do you want to say a word about gatherings like that?
Certainly, it really depends on how it's laid out. If people are able to maintain 6-foot distance and there's good air circulation, then wearing a mask, would be optional. It would add relatively little to the protection against COVID-19 transmission. However, when you get into large groups like that, oftentimes it is difficult to maintain a consistent 6-foot distancing, and it would be wise to add to that by wearing a mask as well. Again, the masks are primarily for source control. My mask protects you, your mask protects me. There is some emerging evidence, though, that there is some level of protection, certainly not 100% for the wearer as well, so that's an added bonus. But if I were going to go to a large gathering where I wasn't absolutely sure that we were going to be able to maintain that 6-foot distancing, good air circulation, etc., I would go ahead and wear a mask.
Governor, will there be an impact on the reopening of schools in the fall if the state's public health emergency status is extended again?
Well, of course, the public health emergency will very likely extend into the fall. Even though we extended it 60 days now, which takes us, I think, into August, it very likely, under the current circumstances and projections, will extend into the fall. But just like you work during the pandemic, you go to school during the pandemic. So I don't see that as an impediment to having school this fall. Thank you all very much for today, and have a great weekend, by the way. We'll reconvene on Monday.
Good afternoon. I'm Dawn Scott in the THV 11 studios. Thanks for being here with us today as the governor wraps up his daily press briefing on COVID-19 with 703 new coronavirus cases in the state of Arkansas in just one day's time. 41 of the cases are in correctional facilities, so this marks the largest growth of community cases we've seen in a single day. You can see it reflected there in our graph by the high numbers announced today. Cumulatively, 14,631 Arkansans have had COVID-19 so far. There are 5 additional hospitalizations, 6 additional deaths, total hospitalized right now 231, and there have been 214 deaths. The highest number in one hospital of patients hospitalized is 33. Of course, the health secretary didn't tell us what hospital that was. He did say the highest number of patients in an ICU in one hospital is 18. And the highest number on ventilators in one hospital is 9. 5,167 tests were administered in 24 hours. The overall positivity rate in Arkansas is 6.5%. That's climbed a bit higher as a result of this past week or so of very high numbers of coronavirus cases in Arkansas. The unemployment rate is down slightly, 1.3% in Arkansas. It stands at 9.5%, and the governor issues guidance on face coverings. It's not a directive. He says a directive ordering face masks is bad policy. It would be difficult to enforce, but he does offer guidance, especially when people are in large groups, can't maintain distance, possibly at church, and they have given some details on how to properly wear a mask and when to wear one, why it works. We're covering all aspects of this for you at THV 11 on this Juneteenth. We have a number of stories related to Juneteenth as well, and we'll have them for you tonight at 5, 6, 6:30, and 10. But for now, we're going to send things back to our regular programming. You can catch the latest anytime on our website, thv11.com.